I'm excited to talk to Quentin Van Meter today, Dr. Quentin Van Meter. Dr. Van Meter has been at the forefront of really raising concerns about puberty blockers and cross-sex hormones for the treatment of gender dysphoric kids. And I just wanted to get a chance to talk to you about some of the, we've had a lot of people talk about their beliefs about these medications and their feelings about them, but you actually have a medical degree. You're an endocrinologist, a pediatric endocrinologist. So you actually know what these medications do. So I was wondering if you could just start out by telling us very specifically about puberty blockers and answer the question whether or not they actually are reversible.
Okay. So just the concept of puberty blockers is pretty amazing, and endocrinology is sort of fascinating, which is kind of why I went into endocrinology. It's like puzzle solving. Everything kind of fits together, and when there's checks and balances. So if something goes up, the other things go down, and vice versa. The way that the gonadotropin-releasing hormone agonists, or so-called puberty blockers, work is by powerfully overstimulating the pituitary gland, so that it downregulates, or it causes, it's like a surge of power that blows a circuit breaker. And as long as the power surge is maintained, the circuits will be off until things clear up and it's safe to come out and try to work again. So it very selectively stops only and just the signaling of the pituitary gland to the gonads, to the ovary or the testicle. And that's how it works. It's a formulation that was made once they categorized the hormone that sent the message to the pituitary. They could mess with it, make it uber strong and sticky, and that's exactly what they did. And voila, you have the ability to shut down that system temporarily. And we do that temporarily in children. Now, it was designed for kids with precocious puberty, that is to say, kids who were 4, 5, 6, or 7, who were starting to show signs of going into true puberty. But it was also developed for a much larger market of adults who have tumors that are dependent on either estrogen or testosterone to thrive. And in order to treat those patients, they developed these drugs for them as well. And it's a much bigger market to shut down the signaling from the pituitary to the ovary or the testicle, and essentially cause those cancers to starve. And that's what their biggest market is. So there's lots of experience in adults where they have these drugs in place for many, many years consecutively. And they know a lot of complications that happen because of them in the adult world. They're essentially, bone becomes very fragile because calcium is not driven into the bone. There are emotional problems that develop with anxiety and depression. There are bones that fracture, hips that fracture, spinal fractures, things like that are all due to this medication. So there's lots of experience in the adult world, but in the kid world, we're doing this usually for maybe at most 3 or 4 years, and most often just a couple of years. And we're doing it at a time in that child's life where puberty shouldn't be happening. We're actually trying to stop what puberty will do. We don't want their bones to rapidly mature and for them to grow very tall very fast and lose the ability to regain that height at the end of their puberty. So we also want to stop the hormone effects. We want little girls in 2nd grade and 1st grade not to be menstruating. We want little boys in that position not to be driven by testosterone to the point where they're doing socially inappropriate things that have sexual overtones to them. So we'll temporarily block that by putting these kids on those medications. We mentioned the fact that there's a possibility there would be emotional things going on, but it's not terribly common. And we're not worrying about the calcium in the bone because it's not a time when that's necessary in young childhood. When the puberty blockers are stopped, the gonadal function comes back. It's not instantly. It's probably a year and a half after the medications are stopped. They'll start to reawaken and start to have re-stimulation of their systems, and you'll see the effects of testosterone in boys or estrogen in girls, and they go right back into where they were, but it's at an age-appropriate time where those hormones are made specifically to mature the brain through adolescence, mature the skeleton, mature the body organs, and do the work that the sex steroid hormones do in terms of changing this infertile youngster into a fertile adult, okay? And that's the purpose of puberty. Puberty has a lot of things that are associated with it that are not comfortable. Acne is one of them, okay? moodiness and disproportionate growth of the body, and obviously the body changes that you see, which makes some people very self-conscious. If a girl has absolutely huge breast development, sometimes it's embarrassing, and the girls will be upset about that in puberty and beg and wait until they get to be 18, when the plastic surgeons will do a reduction mastectomy for them. So there are things that puberty does that are uncomfortable for everybody who goes through. All of us adults went through puberty. We can remember those agonizing years, and probably all of us would agree we don't want to do it again. We got over that fence, and we're glad we don't stay on this side. We don't want to go backwards if we don't have to. So puberty is not a disease state. It's a very important physiologic change. And when you block puberty in the adolescent years, you basically are essentially shutting down the maturation of the testicle or the ovary at a time where it's very important for that organ to begin to develop, okay? And when you shut it down and for 3 or 4 or 5 years, and you then throw in cross-sex hormones, you essentially fry the gonad. You make the testicle essentially useless. It will never regain its fertility, the ovary the same. And so we are sterilizing children by putting them on these puberty blockers. They say, oh, it's reversible. We'll do it for a year or so. Nobody does it for a year or so. When you get on puberty blockers, you stay on them until your cross-sex hormones are given and are working and causing changes. And by that time, you have essentially damaged the human body irreparably.
Well, and I think something that you mentioned is so important, that, the idea that people say that they're putting these kids on a pause so that they can think about their gender identity. But as a number of people have pointed out, puberty is actually the cure to a lot of gender confusion. And so if you block that, you're actually blocking the natural cure that will help a lot of these kids to resolve their trans identity naturally and without the need for drugs and hormones that are going to damage their bodies.
Absolutely. This is driven, this ideology of puberty blockers is driven by adults, transgenders, who are not happy because their bodies did what their bodies were supposed to do. The larynx in the males got bigger, the jaw got bigger, there's hair growth that won't go away. And when you try to turn yourself into a female and you've already gone through full male puberty, you have things that keep you from being the female you want to become. It's impossible. You've got maybe male pattern baldness. You've probably got a deeper voice. Certainly have facial hair and body hair, which can be shaved or removed. But you can't change your voice back. And an example of that is Bruce Jenner, who's in her Caitlyn form. Sounds like Bruce Jenner. I mean, it's unnerving to watch somebody who appears to be a female with a voice that is clearly male. And it's just like, this is a mismatch. I am not comfortable. Neither are they. And what they said is, oh, I want all of this stopped before it starts. And that would have been what I needed, because they're not happy. Now, the thing is, they're not happy because they're never going to be happy. And they just are looking for reasons, but they are the ones that cause the protocols to be developed. Well, if we can stop it before it starts, you see, we won't have those changes, and the patient will be in sort of a neutral state from which then they can decide whether or not they're going to go forward. Well, 100% of the kids on puberty blockers are moved to cross-sex hormones. 100%. Well, maybe 0.5%, don't like it and quit and drop out. And the statistics in those gender clinics in this country particularly, it's a conveyor belt that once you start the puberty blockers, you are on to cross-sex hormones and you are gone. So it's not a pause to make you think and sort things out. It's an artificial, essentially stopping puberty so that you don't get the changes that you're going to be wishing you had not changed when you got beyond puberty. But as you said, the process of puberty is what makes the desistance happen in the vast majority of kids. So here we have an emotional problem to begin with, which is the gender identity issues and the dysphoria. Interesting that term was coined so that you would not make the identity issue a pathologic state, but you would make suffering from it a pathologic state that then could be treated with insurance claims paid, because it's actually a disorder of something, or it's a suffering that needs to be fixed. When really
Yes. If you have dysphoria of any other kind because of the way your nose looks or because of the way your breast looks or because of, as you get older, maybe you
Yep.
want a facelift, the insurance won't cover that. And so
Right.
it's a very specific kind of category of dysphoria that is privileged to
Yes.
be covered,
Yeah.
which is confusing to a lot of us.
Well, it's because it's not logical. I mean, it's kind of the hypocrisy of, everything for you guys that way, but for me, I have special compensation that I get to have because I feel it's my right. Okay. And when you throw it into an inborn issue, as if you're born with gender identity disorder or dysphoria or incongruence, rather, that therefore it's like anything else, it becomes a civil right, if you will. Okay, because you didn't ask for this. It's biologic. It's who you are, and the answer to that is it's absolutely not. There is just no evidence whatsoever that pans out that shows this is anything other than a social, psychosocial phenomenon. Okay.
And in fact, I would suggest that a woman's breast size is more biologically determined, and
Yes.
yet that is not something that insurance companies will cover to have enlarged, at least,
And particular or made smaller.
or
I mean
made
that,
smaller.
yeah. And we have adolescent boys who get what's called gynecomastia, and they'll get significant breast development. I mean, we're talking C and D cup size breast tissue on a skinny chest, and they feel just, I mean, hideous, because it's just they won't go outdoors. They'll put extra large size clothing on and hump their shoulders over, and they need that breast tissue removed by a good plastic surgeon who can leave behind no scars. And it's an art to do that. It's not something that a general surgeon goes in and just whacks out tissue or puts a suction in and sucks everything out. It's a delicate operation to take the breast tissue out. Those boys can't get that covered by insurance. It's not covered. And so the parents, they just basically say, okay, I guess it's going to be out of pocket. And they find a plastic surgeon that will work with them and let them pay over time and do the job. And that's necessary. Okay. To me,
Unless they could somehow convince some insurance company that they're actually a woman trapped in a boy's body who identifies as a boy or something.
they could,
Some kind of
they could,
convoluted.
in this day and age, they could make up a scenario that if they wanted to say, I got to get these breasts off because I'm really,
Right. I'm really,
I'm something else. I'm a cat. Or I don't.
Right. So, Dr. Van Meter, you talk about that this is a psychological issue, and I think most of us who are concerned about these treatments really are very convinced that it's a psychological issue. Someone like me who had gender dysphoria as a child is, completely 100% convinced it is. But there are other people out there who are feeling like we are intolerant and transphobic. And I was just wondering, could you kind of summarize the research that's out there? And specifically, I think it's the Brandstrom research that just recently was updated, or they realized
Sure.
that they had made a mistake. Would you be willing to sort of summarize that and
Sure.
talk about it?
So what we find is that, I'm going to just talk about the literature in general for transgender. This is something that's been published about since the 1970s. There was a pause between sort of the early 1980s and probably around 2000, 2005, when this was not an issue on the radar screen because nobody talked about it, because it was thought to be a disorder, and purely and simply, and the adults who wanted to go through treatment protocols with medicines and surgeries did that on their own. They found practitioners who would do that for them. They were under the radar screen, and it was in the background as a small fraction of people with a mental disorder. That's how it was. And then we started getting, in Europe, they began collecting data on adults, and then eventually in the Netherlands, starting in 2000, they started bringing children through their clinics. Interestingly, they had a really strict protocol where they basically weeded out all the desisters by counseling. I mean, they did what was necessary. They did a thorough evaluation of the emotional background and weeded out essentially everybody that they could. And it was a small fraction of kids were left who were into adolescence, and they then started putting them through these protocols. So that's the background from which there was literature, is the desistance happens over and over and over again in very large numbers. 13 of 13 published studies on desistance, whether or not it works or not, showed it did work. I mean, that just counseling, the quote, watch and wait, which is not really just passive and sitting there. It's very aggressive and interventional. That worked. And so those are all thrown out now as, oh, those are old data. Old data. See, that's not valid anymore. We have new data, okay? So this famous Swedish study of Dehane came out, and without any bias at all. Their intent was to show the benefits of the surgical and medical treatment combined in adults, and they found, oops, they had a 19-fold increase in suicide in those patients who went all the way through compared to the general population of Sweden in the background. That was their comparator. They didn't have a comparator of medical only or watch and wait only. They just had that one, they collected data. And this was not a survey of people who answered questions. This was the database of every human being in Sweden with a diagnosis of transgender. So there's no bias of, leaving people out because they had bad data or leaving people out because they died and couldn't answer a survey. It was everybody. And that basically was the backbone of our concern, saying this is all going to make mental health matters worse. That just didn't satisfy the agenda people. They said, no. It was a bad study. It's flawed somehow because it gave data they didn't want. So they hounded the authors of that study, who basically kind of shied away and said, oh, maybe it wasn't very good. Maybe we don't mean what we wrote, okay? That they used that. See, the authors now are retracting their support of that article. Poor quality. So they began to design clinical studies that prove what they want to prove just by the way they're designed. Here in the United States, the clinic in Seattle did a 1-year study, which they published. The data was in the journal Pediatrics within weeks to months of being complete, which is absolutely uber fast. I mean, mostly studies are finished and then about a year and a half later, they'll come out in publication. This was ready, greasy skids, get that data in, write your article. We've accepted it before we even know what it says. And they showed that kids who were age 5 through age 13, who were socially affirmed, this was just social affirmation, were much, much, much happier at the end of that year than who? Well, they didn't have a comparison group. They didn't have kids that were counseled. They just did kids that were affirmed socially. So they published that, and then you dive into the article and you realize that the people that evaluated their happiness were the parents. Now, if you were a parent and you got an opportunity to be part of a clinical study and you volunteered to go in, you weren't everybody in their clinic, you were only the volunteers, and you put your kid through this, are you going to be not somewhat warped in your judgment and be objective about whether or not your child is happy? And they called the comparator their siblings. Okay, that was their control group. This is so bizarre and so absolutely rotten in terms of a study design. And it was published and touted as proof that affirmation is good. Then they designed a 4-year study through the NIH with 4 centers, academic centers in the United States, Los Angeles, San Francisco, Chicago, and Boston. And they designed their study to review kids with transgender who were being treated with medicines, not surgery, but medicines, and also affirmation socially. And they designed it so that any kid with any degree of depression or anxiety was kicked out of the study after it started. So they come to the conclusion, which is going to be published probably within the year, that actually 5-year data shows that medical and surgical stuff improves their life completely, okay? And they're happy. So this is a study, and they call this science, and they call it new and up to date, okay? Well, accidentally, Dr. Brandstrom in Sweden did another really deep dive into about 2,000 transgender patients, I think half of whom had surgery. And he came to a conclusion in his paper that, well, the medical treatment didn't seem to make any difference in mental health at all. No improvement. And that was buried like an, oh, by the way. But the surgical treatment had a dramatically improving situation for their mental health. And that was published last October in the American Journal of Psychology. So the Brandstrom study came out as new brand new. See, this is great data. And just before that, there was an article published by a doctor named Jack Turbin, who's a very strong trans activist who's in Boston. And he published a study where he claims to have gone through 25,000 surveys that were done from about 2009 up through 2017. And they've teased out about 180 or so patients who'd actually had puberty blockers given to them. And they also asked on one of the questions, if you had been able to have puberty blockers, would you be better off? If you didn't have them, are you sadder as a result of that? And it's a convenient sample again, okay? And on top of that, it was the enticement to answer this survey was a door prize, or you know, you put your name in a hopper and you could win some money or gift cards. So they don't know how many of these 25,000 put in 10 or 20 surveys, but it's perfectly appropriate that it could have happened. There's no sorting out of who's who. They clearly didn't get any surveys from people who were morbidly depressed or who had killed themselves. So they weeded out, it's a convenient sample that proved what they wanted to prove, that indeed puberty blockers improve the mental health of those who had them, and those who couldn't have them, it made their mental health worse. That's what they published. It was immediately put in, it was in the Pediatric Journal again, it was touted on, you know, New York Times, Washington Post, and MSNBC, you name it, they were here, they were interviewed. Oh my gosh, this is the study that shows unequivocally puberty blockers benefit the mental health of these patients. Well, some of us looked into the study that, as it was written and designed, and looked at the data and realized that it actually proved the opposite. The conclusions were bogus. We pointed that out in letters to the editor and a couple of physicians that I know, and then others started to write in, and their letters were not published. They wouldn't publish them. Okay. So Dr. Turbin's article is still used as a pinnacle of, quote, new and up-to-date research with 25,000 surveys to review. I mean, how powerful can you get when you've got data that strong? Oh my gosh. It is absolute and utter useless garbage. And it statistically shows the opposite of what he claims to prove.
Well, and people who know anything about methodological validity can look at these immediately and realize that they're bogus because they're self-selected samples. And in the ones that I've looked at, they're actually distributed by LGBT pride centers.
Yes.
And so, and like pro-trans organizations. So they're reaching, you know, the very group that is going to be enthusiastic about this. And as you said, if somebody's killed themselves, they're not going to be able to take the study. If somebody has decided this was completely the wrong track and moved away from it, they're not going to be affiliated with those organizations and either in order to find out there's even a study going on. Or someone in my case who desisted would never get that study. And so, and they're self-reported. So they're self-selected and they're self-reported, which is, you know, maybe interesting for some preliminary data gathering, but is not a valid research methodology.
Well, what happened then with Dr. Brandstrom's paper from last October, which proved that surgery did majorly wonderful things, and the fact that he said in his review, medical treatment did nothing to improve mental health. That is huge. Okay, that needed to be the first conclusion of the study. And then you sort of deal with the second conclusion. And then when his paper was reviewed and letters to the editor came in saying this is statistical garbage, he did this statistical analysis incorrectly, he crossed over groups, and actually it proves that surgery caused anxiety in a higher rate than those who didn't have surgery. But otherwise mental health was not touched at all by surgery. He actually admitted that. And they did a correction. They didn't retract the article. They did a correction of the article, which came out last week. So here we have now current literature by trans pro people that shows that neither medical nor surgical intervention makes an improvement in their mental health. And we know from our clinical experience, conservatively, 70% of the kids who come in with gender dysphoria have enormous emotional upheaval before all this happened. And I would say from my personal experience with interviewing patients, 100% of my patients come from totally dysfunctional environments that have scarred them emotionally. Okay? So here we go with something that is not inborn, that is due to really adverse mental health to begin with. This is when I wrote a letter to the California legislature about their transgender support bill, I said, imagine if you were a child who was horribly depressed and you're walking through this lonely road in your life, and it's dark and it's scary, but off in the distance you hear something that sounds like laughter, and you see some light, and you stray off the path, and there is this beautiful carousel with horses and brass poles and cotton candy and happy music. And someone outside the carousel says, do you want to come and get on this carousel and leave this sad road? And you say, okay. And you get on that carousel, and they keep feeding you cotton candy, and they keep polishing up and repainting the animals year after year. And you are asked about, along the way, do you want to leave this and go back to that road? And you'd say, no, I've got cotton candy and I've got happiness and music. I want to stay here. I like this. And then you realize you're going around in the circle, and you've been going around in this circle for years and years, and you try to get off, and they say, you can't get off. You can't jump off this thing. It's going to kill you. And so you stay on, and it's a circular hell that you've lived in. And that's what transgender affirmation is a circular hell. And so you jumped off that carousel. These sisters have jumped off that carousel. It wasn't easy. They got bruised and banged up and had to come back and put themselves together. But once they were off, they realized what that was, and they thought, never again. And I want to stand up and shout, don't get on the carousel.
Well, and as you mentioned, as a little kid, I have no doubt if that carousel had been available for me, I would have run. I would have hurled myself on it, because part of the trans identity for a lot of these kids, and me included, is escaping. And if I can run away from that, I'm going to do that, because that's how kids' brains work.
Sure.
They're not mature enough to handle it. And some of this stuff is so heavy that they really can't handle it on their own. And thankfully, I had therapists who were able to walk with me while I kind of unpacked what had happened to me, and was able to resolve that trans identity. But it's hard, as you said, in the short term.
Sure.
But in the long term, you're not running away from yourself for the rest of your life.
Right.
Whereas if you get on that carousel, that's what you're doing, is you're running away from yourself for the rest of your life. And you're adding all these medical problems as well if you go through medical transitioning. So instead of just having the psychological effects, now you've got problems with your bones, and you've got, even processing issues maybe. I've heard just horrible things about, the hormone treatment and some of the things that can do. Plus, if you've been on it long enough, you're infertile. And it just is, to me, it's so unfathomable how doctors are embracing this. And I just wonder, I asked Michelle Curtella this in an interview, and I just was curious with you, how do you explain doctors embracing this? Because to me, it's like everybody's gone kind of crazy.
Well, it's insidious, okay? The way that the professional societies got these endorsements and guidelines was by activists coming in, saying, hey, we have a novel problem here. We're the experts, and we have a novel problem, and we'd like to be the directors of recommendations. And well-meaning professional societies, the Endocrine Society is one of them, the American Academy of Pediatrics, which tends to be a little bit more socially, progressively proactive, jumped on the chance, absolutely and utterly. Oh, good. We want to have an expert. Okay. Now, they didn't do a panel that looked at all sides of the issue in either case. It was just trans activists who had a chance to sit down and write some guidelines. The Endocrine Society guidelines, I don't know if 100% of the original group were members of the World Professional Association of Transgender Health, or WPATH, but that's an organization that is clearly political and social. It's the scientific basis of what they do is nil. Okay. Their bibliography is basically anecdotal cases and the schlock that they're promoting.
Well, and based on the survey that they send out, this survey, and they ask these crazy questions, like it's almost like if you weren't 100% affirmed with medical treatment that you wanted, included puberty blockers, hormones, and surgery, then you were denied medical care. you
Right.
know,
Right.
or if somebody suggests like maybe that, you know, hey, maybe there's something else going on, then you were bullied. And so
Right.
the way that they word it is so skewed to get the results that they want, so that they could show that this is a group that is profoundly oppressed and bullied and marginalized. But if you look at the actual survey, it's outrageous. I mean, the conclusions they come to are just absurd, and the questions that they ask are crazy.
So these groups, these activists, essentially infiltrated the professional societies, a couple of them, key ones, okay? The Endocrine Society being one. Secondarily, the Pediatric Endocrine Society, which is a separate group, just picked up those guidelines and actually added a little extra oomph in their direction that they wanted to. The American Academy of Pediatrics independently sort of took those same guidelines and wrote things that are even more bizarre, okay? And these are not refereed. These are not refereed at all, okay? They are basically, this is what I think is right. The endocrine guidelines particularly have no scientific basis for the vast majority of what they recommend, and they say so. They say, these are our opinions. We believe, and therefore we recommend the following, okay? Studies must be done in order to verify what we're doing, but we're gonna start treatment anyway, okay? And up front, they all have the caveat, with the exception of the American Academy of Pediatrics, they all have the caveat that a thorough investigation of the child's mental health is done up front, and the child does not move into the system of treatment until that has been done and we understand. And we recommend only transgender specialist therapists do the evaluation. Okay, so here we are. We're setting it up to send your kid to a transgender affirmation psychologist who says, "Yep, you got it. Okay, here's your letter. Stamp it. Take it to your endocrine transgender clinic, and they'll get you on the pathway in a matter of weeks. You know, done and done."
Yeah, I
Okay.
mean, people assume that somebody has to be having this identity for a very long time, and
Right.
yet I've heard cases where, you know, somebody goes in, you know, like you said, a month, and they're on testosterone or estrogen.
Right,
It's
and they get recommended by a teacher at school who's an activist, okay, and decides to descend on this poor kid who may be on the autism spectrum and is socially isolated to begin with, and they say, "I think you're transgender. What's that?" "Well, here, let me show you. I want you to read." And they get into their, you know, ooh, you know, and they go for that carousel, okay, because they're on that darn road that is so horrible to stay on. So you've got these guidelines coming out, and they then get imprinted, and every other professional society who doesn't know any better jumps on the bandwagon. American Medical Association, American Association of Family Practice, we fully endorse these guidelines because they are by the experts. Now, I'm an endocrinologist. You know, I look to the guidelines to help me through disease states where there's murky waters, okay, and where there's new stuff coming out. And I would inherently trust them if if I see something that sounds a little wacky, I start looking into it. I just happen to know a lot about this background because I was there when John Money was experimenting on children in the 1970s, and I saw it happen then, and it's nothing different or nothing new under the sun. So I'm an uber skeptic, and I go in and I say, let's see what the recommendations are. Let's see who's made them. Oh my gosh, all of them are trans activist people. All of them, all of them. Where was Paul McHugh, the director of the psychiatric department at Hopkins, who is the world's expert on human sexuality and internationally published renowned? He's no mention. Where is Kenneth Zucker from Toronto, who ran his clinics and evaluated these kids and got them to desist, as the majority of them? He's nowhere in there. Okay, all of that is not asked for as an opinion because they wouldn't have had the guidelines happen if they were on that panel. So, you know, people jump on, and then you could throw in there that, oh, if you don't agree with us, you're not woke, and you're transphobic, and you're a racist or whatever, you know, xenophobe, and just the list goes on and on. If I try to do a presentation at a major endocrine meeting and suggest the topic and where I'm coming from, I'm not invited.
So they really silence anybody who doesn't agree with.
Absolutely. Now, I am not dependent in an academic position because that's not where my income comes from. But academicians are rolling their eyes. The ones that are my generation are going, oh my God, if I can't say anything because, you know, I'm basically gonna be a pariah amongst my peers because all the younger ones are just lockstep in there, just marching through. All the endocrinologists, pediatric endocrinologists in their 30s and 40s, oh my God, they're jumping on this as if it's gospel. gospel. And
Well,
they
and
don't.
part of it is the suicide issue too. And I don't know if you can address that, but one of the, motivating factors for parents to to agree to this treatment, for practitioners to give it, is that they're told that children will kill themselves if they're not allowed to have these treatments. So can you just address that? Because that's a really powerful motivator if you think your kid's going
Oh,
to kill
absolutely.
themselves.
So the two big lies are you were born in the wrong body, and that there's proof of that, and that if you don't allow that child to be affirmed in their perceived new gender, that they will kill themselves. And that's, as they say, do you want a dead child who's living in their biologic body, or do you want a live transgender child who will be happy the rest of their life? Okay. And parents are guilted into that. I mean, that is a powerful threat. Okay. And that's what makes state legislators go bonkers and say, oh, we want this therapy. And if you say they can't have it, you're converting this child back to their biologic sex. Oh my God. They call it conversion therapy. Who's converting who? They're converting a biologic male into a female and females into males. That's conversion. That is an actual attempt to convert, which you can't do, but it's, they own the language and they throw it at us that way. But the suicide threat is quoted often. 41%, 60% will attempt suicide. Then you go look in those articles and you tear them apart and you realize, well, what they said was that, had you ever thought that you might cut yourself, or were you ever so depressed one day that you didn't want to wake up? And that was suicidal ideation. Okay. Oh, there it is. Suicide, not completed suicides. Some thought that were you ever depressed? Well, yes, 97% of people who commit suicide have undercurrent depression and anxiety. Hello? I mean, and it's not because of societal rejection. It's because you're depressed and anxious at the core, okay? So then they look at the data that they came up with in this 40%. It actually turns out to be 21% have a suicide attempt, okay? It's the same as depressed and anxious people. It's the same as same-sex attracted people. It's the same as autistic people. It's the rate. It's the rate of suicide attempts, not completion. All right. So it's no different than any other background. And then on top of that, you now have the study from Sweden, which showed that medical and surgical intervention in 2,000 plus patients did not make mental health any worse or better, except it might have made it worse with anxiety in the surgically intervened people. There you have the data, okay? So,
And my understanding is that the data is also based on fairly short-term results.
yes.
And that's really important because
Yeah.
the Swedish study, the original Swedish study that showed the 19-fold increase in suicide rate was over, I think, longer than a 10-year period. And they
Yeah.
really showed a sharp increase in suicidality after that 10-year mark. And it's almost like they realized maybe the carousel was slowing down, or maybe it wasn't working anymore. Or maybe they realized that all they were doing was going around and around. And then that's when they completed suicide.
Yeah. Yeah. So the suicide is a myth. It's a total myth. It's misquoted. It's often quoted. It's used as a hammer to guilt parents into doing this, and it's criminal that someone gets away with that. So the two big lies are born in the wrong body and commit suicide if you don't get what you want. Then the real realities on the other side are, you've probably taken somebody who might have been on the pathway developing same-sex attraction, and you sidebar them out where they might have been an adult who was gay or lesbian and had a happy life or a reasonably happy life without medical conditions induced by medicines and without mutilating their organs. You can't make a breast out of nothing. You can give males estrogen and the breast tissue will grow, but in females who have their breasts removed, there's no returning, getting the tissue back once it's amputated off the body. When the penis is gone, it's gone. You can take some vascular tissue and you can wrap it in skin, and plastic surgeons are spending hours and hours training to make artificial penises to sew on the front of the area in the perineum for females to have something to hang between their legs, creating scrota that they put artificial testicles in so that it hangs down, and calling that a functional sexual anatomy. There's nothing functional about it at all. It never will function the way the normal anatomy will. The vaginas that they create boring holes into the perineum and lining it with skin of the penis or wherever, if there's not enough to do that for other skin or mucous membranes. It has no ability to secrete secretions. It has no sensitivity, sensation. Orgasms are not what you get. There's no normal sexual function. The kids that come in early are dreaming that they're going to turn their bodies into the opposite sex, that they can actually, and I ask them, do you think you can become a woman if you're born a boy? Uh-huh. Really? Uh-huh. Where did you learn
And
that?
that's age appropriate.
Yeah.
I mean,
Yeah, very,
that's part of the issue is that,
sort of fantasy ideas, not concrete thinking at all, wishful, hopeful. They don't know what an orgasm is. How do they, I mean, they don't know what fertility means. Okay. And you're
they've
letting
had
them make
adults telling them that it's possible. And so
Yeah.
of course they believe it.
Sure. Absolutely. So there's so many lies perpetrated, and it's why would somebody do that? I mean, that's what I ask my question. Why would physicians go along with this? And it's just, I think the social pressure is totally immense, and the literature is being published is so skewed on purpose to prove what they want to prove, and they won't publish what, I mean, it took us 2 years to get our letter to the editor into the Journal of Clinical Endocrinology and Metabolism, and it clearly said we have severe concerns about the use of puberty blockers in normal pubertal children.
This consent issue gets really fuzzy because children are not capable of giving consent. And I would argue in this case that adults are not able to consent to these procedures because we don't have longitudinal data about what these procedures are going to do. And
Right.
How do you consent? How do you write a consent form for something where we don't even know what the outcomes are going to be?
Well, it's interesting when you read the consent forms, because they do actually in tiny print say, well, we know that, estrogen in males is going to increase the risk of stroke. And we do know that cancers and, et cetera, and heart attacks happen in women who are on, who have high levels of androgens. But that's, you're going to die from suicide if you don't do this. And so it's, you want heart disease and a stroke, or do you want to be dead now? There's your choice. You sign this paper, and that's how the adults are talked into this. Okay.
Well, and the other thing is the suicide attempts. And I want to be very careful because I don't want to minimize anybody's mental health issues. But there are a fair number of suicide attempts that are listed as suicide attempts that clearly will never result in a completed suicide, that
Right.
are, calls for help or
Yes.
or whatever you want to call them. But for those to be listed as, it's a different category.
Sure
And when you have doctors like Dr. Wallace Wong from Canada telling parents and kids that if they want the treatment to fake suicide,
yeah.
Well, then we don't even know what the data is for suicides because we don't know if these are kids who are faking it to get the attention because they've been told this is how you get it, or if these are kids who really have serious mental health issues. Either way, they shouldn't be getting the medication because if they're faking it, they don't need it. If they have serious mental health issues, they can't consent.
Right. Yeah. So it's either side of the coin is that consent is not possible.
Right.
Possible. And the overarching thing over all of this, and we need to come back and stress it, is that we have incredible compassion for the suffering for these kids. Not a one of them is well. I mean, not at all. And our jobs as physicians is to heal and to get them toward wellness, if at all possible. And again, weighing risks and benefits. But when we know that wellness can be had by intense involvement with counseling and digging deep into the cobwebs that have sort of upset this child's total emotional fabric, and if we don't do that, we are not compassionate. We are actually throwing them on a conveyor belt so that they can, the vultures can come get them and mutilate their bodies. And so our compassion is very strong. It's not like we say, hey, we think you're crazy. Just go home and get over this, and stop calling using the other names and the new pronouns and stuff. Just stop doing it. Just stop it. You're crazy. It's in your head. Get better. I'm not doing anything for you. That's not how we do it. Okay. I hang on to my patients and I call them back and say, you didn't come back for an appointment for follow-up. I just want to get a pulse of what's going on in your life. Where are you with this? Did you read the articles I gave you? Did your parents have a chance to go over this with you? Is your mother and father live in different households and there's a war between them? Who is winning the battle and who is using this? We need to help you. We need to preserve your mental health and heal you. It's all about compassion, not about, oh, well, you're just crazy, get over it.
Well,
And
it's the
that's how
same
we're
way you would,
portrayed.
yeah, it's the same way you would treat anybody who had a mental health issue. If you had an anorexic come into your office, you wouldn't just tell her to go home and eat food. You
Yeah.
realize that she had an issue. And the
Yeah.
same is true for these kids. And
Yeah.
I know that we're almost out of time. I was just curious because you sort of alluded to it, that there are situations where you have parents in two different households that are arguing about transitioning the kids. And I was just wondering if you're aware of any of these cases. There are a few cases, Jeff Younger and Rob Hoogland and Brenton Netz are three that I'm very familiar with that have been in the news of cases where either the state or one of the parents is trying to transition the child, and another parent is saying, "Oh no, please don't do that. Please don't do this to my child." And in the case in Canada, he was actually, Rob Hoogland, who's the father, was actually, he lost medical consent to his daughter was started testosterone without his consent,
Right.
and has been now for a while. In Jeff Younger's case, it's going to go to court soon to see the mom's going for custody again. And I was just wondering, do you testify in many of these cases? Because
Yeah.
those are the ones I know about. Are there others that are
There
happening?
are others. Yeah, there are also others. I have Gavin Grimm in Gloucester County, Virginia, the suit against the Gloucester County school system for not allowing him to go into the the boys' restroom, and when biologic female. I also testified in another case in Texas, and also gave an affidavit and testified in the Vancouver case as well. So we're out there on the front lines trying to educate people and say, look, this is being presented as if it were science, and you have to understand it is not. I'm going to be talking again to the California Assembly, this time to the Senate hearing committee, that's trying to erect out of the ash heap the Assembly Bill 2118 that is going to try to get $50 million so that transgender people can have carousels.
Well, and literally, I mean, I just read some of the legislation,
Yeah.
and it's not actually literally. Okay, I hate that use of word, but it is for them to have art
Oh,
and
yeah.
dance and meditation,
Yoga classes. Yeah.
yoga,
So that they can embrace their transgendered self.
transgender
Yeah.
dollars in
Yeah.
order to basically, what I say, create that carousel for these
Yeah.
kids, so
Yeah.
that they're like, oh, I'm going to go over there. Look at what they have. They have a carousel.
Yeah.
I mean, that's exactly what it seems like they're doing. And to me, I actually submitted a letter too, because I was just horrified when I read it. I mean, it's bad enough that we're medically transitioning kids who are coming forward, but now they're going out and recruiting them by setting
Yeah.
the carousels up right there in the schools.
Absolutely. Well, that brings one last point. I view all of the transgender activism as a religious cult, okay? And let it be a religion. I mean, if that's sort of what it is, okay? It's a belief system that you have no scientific proof. You might have some little anchors here and there that sort of tell you that what you believe has some, physical and scientific validity for sure. But it's mostly that you just believe it, and that's all that you need. And that if you carry that through, there you go. So that's a religion, okay? And do we bring our Christian and religions into the classroom in kindergarten and preschool, and imprint on them and say that you must, this faith is what is the law, and if you don't follow this faith, you are breaking the law, okay? No, we don't do that. We have the First Amendment that protects us from that. So why would we allow this religion in schools? And it's now down into preschools in California. So,
and it's not in any other religion that I know of. I don't know of any other religion where they actually encourage people to self-harm,
yeah.
and where they encourage them to cause permanent damage to their bodies. I mean, even some of the more obscure religions, I don't think, tend to advocate the degree of self-harm that transgender advocates do. So,
yeah.
Well, thank you so much for your time. I really appreciate it. And I'm very thankful for doctors like you who are standing up and speaking out about this, because I'm sure you do get pushback. I'm sure that, sometimes you do get harassed. I know when we were in Alabama, you and I both had some incidents with some trans activists who were not happy with our stances on things. And so it is, as you said, there are people who are not able to stand up because they'll lose their livelihood. And so I appreciate that you are doing this.
Thank you. I'm very happy to help out. And anytime that we can have a wonderful conversation, I would love to continue.